I apologize for being late. If you would please rise and join me for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. With that, we open our hearing on the retained bail bills. I understand we have someone today, Allison from Cheshire County, who would like to address us, please.
Right. Red light is on?
Red light means go. I
That's
know.
counterintuitive to me because I'm on a lot of boards and, okay. All right, good morning. My name is Allison Welsh. I'm from Cheshire County. I have been the treatment court coordinator, which is the drug court. We just changed our name a couple years ago, since September 2013, since its inception. And I also provide oversight to the behavioral health court programs, which are alternative sentencing and mental health court. And I know you're specifically interested in pretrial programs. We sort of have a hybrid right now. I have spoken several times with our county attorney, Chris McLaughlin, who's also interested in having pretrial programming, expanding it. And he has a vision for it. I can talk about that later on. I will say that Stratford is clearly the model for the state. They're also much bigger than we are. But Carrie Conway does a phenomenal job. They have a few more programs than we do. We're doing our best. You know, I don't have to remind everyone here, we're a very rural community. We do our best with the resources we have. So we'll never have the census of those large counties. I remember hearing Carrie say they have 500 people in their programming. If I total like the jail population, people in drug court, behavioral health court programs, and even on pretrial, I wouldn't get to 500. So let me just start with the fact that of the 10 drug courts in this state, we all follow best practice. We're all evidence-based, but we're all completely different. We have different models, even though we try to be the same. We appreciate the funding and we do really well. Like for my drug court alone, we have the state funding, which is phenomenal, but we also have opioid funding from the settlement. We have the MOUD funding, and we also wrote a BJA grant for our recovery coach because we felt like that role is a really important role to have in every team, and that's becoming a best practice. And SAMHSA and the NADCP All Rise, who set the guidelines for drug courts, are now recommending peer support recovery coaches on every team and are releasing guidelines this month, hopefully soon. So I'm sure like some of the more important things for you, and I know you're going to barrage me with questions, I'm ready, are the financials. So, and this went up significantly since I last got these numbers. So to incarcerate someone for a year in Cheshire County, the current costs, and this was done by Cheryl Trombley, who's phenomenal, head of finance at the county. So the current cost is $68,985. And I know you were hearing per diem, so that's $189 per diem roughly. To put someone out on EM, which all of our programs use the EM at the jail, and Captain Blasek does a great job there. The rough cost was $2,592, which is about $7.10 a day. And I'll say that she does a sliding scale. So that's different for everyone. The drug court estimate, and I have estimates for different years, per participant is $14,275. So a significant savings for putting someone in jail, clearly. And that per diem is about $39.10. Behavioral health court programs, and I'm sure you've heard about the workforce shortage. So I typically have 2 full-time case managers who oversee both programs. During COVID, we lost 1 staff member who wanted to work from home. We were all back full-time. So my budgets are a little different. So I have 2-year budgets just so you have that. So 2022, the budget was lower because we weren't at full capacity staff-wise. So that's average per client. So drug court, we talk participants. Behavioral health court, we talk clients. So that average cost was $2,820 per client at a per diem of $7.73. In 2021, when we were fully staffed, it was $3,725 per client and $10.20 per diem. That said, the numbers vary a little bit in the program level too. So those costs probably are more in line. The alternative sentencing program was started in 2001 and was the first problem-solving court in the state. And so Cheshire tends to be progressive, and it's a very collaborative community. So the alternative sentencing program works with people with a substance use disorder and they've been charged with a criminal offense. The mental health court program, and I couldn't get the exact date because I wasn't there when they started it, started in either 2004 or 5. I reached out to the former coordinator and he couldn't remember. And that's why he's not working with us anymore. Just kidding. Anyway, it's an alternative to the traditional court system. It's a problem-solving model, and we connect individuals diagnosed with a mental health disorder and or substance use disorder to a variety of rehabilitative services and support networks. And I'll tell you that population is typically severe and persistent mental illness and a very complex population. And then for that program, we do monthly court reviews for the people that are in Superior Court. And I know you've heard a lot of testimony about the overwhelming number of cases in Circuit Court. So our Circuit Court judges are very supportive of the programming, but we've not been able to set up monthly reviews. We're trying, and they've reached out to me a few times. So we do have a meeting to try to see if we can set that up. Now that we're fully staffed, we do have both case managers in arraignments for the Circuit Court arraignment days on Tuesdays and Thursdays. So they're taking in more assessments. Typically, the judge will say, can you assess them? And so I just was reaching out to my case manager. She said she gets 6 to 8 assessments per month. So once again, a much smaller volume than what you guys have been hearing. Referral to the behavioral health court programs can be made by prosecution, defense attorney, probation, district or superior court judge. They're usually part of the criminal court, and they can be pretrial as a condition of bail or post-adjudication as part of an individual sentence. So I just want to give you some background on what that program does, and hopefully that's helpful. So when someone comes in, the counselors do a full biopsychosocial analysis, and they're both trained. Judy's an MLADAC, and our new hire, Lisa Worth, is an MSW. So they fill out a full biopsychosocial, and then from that they create an individual service plan that the client signs off on. And then they do a myriad of referrals in the community. So they're typically referred to community mental health center. And so that, again, is a little bit of an issue for us right now. We've had a contract with them for years. And when I met with the executive director, and he's a man who's brilliant, and I respect him, Phil Wysack, he said, I can't in good conscience sign this contract. And what that contract did was expedited services for people in our programs. So he said he could not sign it because he was down 38 in staff. So I'm sure this is like, you've heard this repeatedly, we have a staff shortage issue for licensed counselors in the state. So in those programs, everyone, if you're not insured before you enter the program, you're certainly insured while you're in the program. Before I came on, Medicaid expansion wasn't part of it. So the cost of the program was much higher for the county. Since Medicaid expansion has taken place, our cost for the program, which is why the cost that I gave you earlier per client is down significantly. So we used to have to pay for treatment for clients. So now all of our clients are covered by either Medicaid or some form of Medicare as well. Each client gets full case management services. Each week they come in. They're referred for employment services, educational, such as high-set tutoring, vocational training, parenting classes, giving housing assistance. And there's a pilot program that I created with Keene Housing for initially treatment court, and now we've expanded to alternative sentencing, not yet mental health court. And it's a voucher program where participants or clients pay 20% of their rent up into a certain amount. So that's a new program. Keene Housing's been phenomenal with that. The case managers work on helping get clients med stabilized. They do a full money management plan, budgeting, and we have housing programs. We work closely with the shelters, City of Keene, 100 Nights, Southwestern. And we also, if they don't have phones or can't get phones through SafeLink, part of our budget has been providing phones and phone cards, especially during COVID, when all of our treatment was telehealth and case management was telehealth. And transportation, I'm sure you've heard transportation and housing are the biggest barriers for everyone, especially in rural communities like us. There's a wonderful man in Dublin, New Hampshire, who has a program, Bikes for Peace, sorry, Jeff Powell, and he has donated so far about 20 bikes in the last couple of months. That's not going to be great for the winter, but it's been incredibly helpful. We also provide bus passes, but the bus has a very limited route. I am on a local MRCC, which is trying to expand transportation in our community, working closely with mobility managers through Southwestern. The program also has randomized UA testing. We do with the Patient Service Center. I think I've already gone through a lot of budget numbers with you. Just so that program, typically, like if you are flawless and perfect, which we don't expect, it's 90 days. But we have people in that program for 2 to 3 years. We've had a lot of success, and I know you're more interested in pretrial, so I'll tell you, like in 2022, 31 people were pretrial, 15 were post-adjudication for the mental health court, 8 were pretrial, and 5 were post-adjudication for the alternative sentencing. And in 2021, 27 were pretrial and 36 were post-adjudication. So for this current year, which still is not resolved, we have like right now 13 clients active in those 2 programs, 35 since the beginning of the year. 14 clients have successfully completed the program, so it's a 64% completion rate. 8 have been discharged, and I'll tell you that they get lots and lots of chances where someone's discharged. Similar with drug court, it takes us a long time to terminate someone. In 2022, there were 49 clients, 24 successfully completed the program, so it's 73% rate, which is great. I'm hoping that we get back up there. 9 clients were discharged, and 1 client sadly passed away. And I can continue on those numbers. I don't know. I know you've heard a lot about drug court. I'm not sure how much you want me to go into drug court.
Only as much as it deals with pretrial or
So
bails.
the drug court model is post-adjudication.
Okay, so no.
Not at all. Yeah. So I'll tell you that it's post-adjudication, and I know some people spoke of other tracks. So we are high risk, high need, like everyone else around the state. The only one thing we do differently, and we've only had one person take advantage of this, is if it's your first felony offense and you successfully complete the program, you will not get a felony record. But it's kind of hard to hit high risk, high need, and not have several felonies. Most of our population has, about 5-10-page rap sheet. A little background on me: I was a prosecutor in Manhattan and a public defender in Oregon. So I was a lawyer many, many years ago. So I have a criminal justice background, not clinician, not clinical at all. So we are fortunate in the sense that we have a lot of funding from the county. We also have a Friends group. They initially were the Friends of Cheshire County Drug Court. We changed our name to Treatment Court. And then when I started to oversee the behavioral health court programs, they're now the Friends of Cheshire County Recovery Court programs. So they provide us with a lot of incentive funding. We have a contingency management program in the behavioral health court programs that they fully fund. They provide incentives, they provide phones, they've delivered food for people for us for when they had COVID, and they're super supportive. We've had Chamber of Commerce presentations to reduce stigma around mental health. We have another one coming up November 13th in Cheshire County. So it's community members.
Allison,
Sure.
if I may, not to interrupt you, but
No,
it's
go
what you're
for it.
speaking of specifically, the behavioral health that you're kind of mentioning, like scattering a little bit. And I know I speak for pretty much every member of this committee when I say we are hearing so much about that every single day. And one of the things, of course, being from Cheshire County, I've been saying we have this, we have this, we have this. And when I was talking with Chris last week, and he had mentioned that, and correct me where you can if I'm wrong here, that the state did adopt, it was almost like a grant program, and that Cheshire County grabbed hold of that several years ago and then made that be what it is today. So one of the questions we're hearing so much about is, state unfunded mandates. Could you talk a little bit about how it was that Cheshire County came to adopt this behavioral health program and where it is today because of that?
So yeah, that happened before my time. So I've been there since 2013. I know that we're a very progressive county, and a lot of people were not thrilled with the incarceration rates. And our incarceration rates have gone significantly down. So they did create programming. A lot of the sentiment in the county is to get treatment, provide help beforehand so you don't continue incarceration. I'll tell you the most frustrating thing in my role, I received a lot of calls when I first started about people wanting to get their children in drug court. And I said, unless you want them to go out and commit about 20 crimes, I'm never going to see them. But a lot of these programs developed because you couldn't get access to treatment. So we had to develop relationships with the community mental health centers, with local treatment providers to create access. I mean, a lot of the crimes kept happening because they were drug related. So the program has expanded over the years to get access to treatment, get access to medications, and to stabilize individuals in the community.
So basically, there was a lot of advocacy. There was a lot of advocacy between the leadership of the county and then the various CAP programs that the county has. Okay.
And like the drug court funding, a lot of the programs started by federal funding
Sure.
and then became incorporated into the county.
And the youth diversion program, I know we speak of that a lot whenever we're in our executive county. For those of you that don't know, I'm obviously in Cheshire County. We speak a lot about the youth diversion program, and I've talked to several people that have had children that found themselves in some kind of trouble, and it could have been detrimental, and that path put them right again, if you will. Do you have any information that you could speak a little bit about that?
That's funny because I asked her to come speak last week, and she said there was some representative from the program. So I've met with Alyssa Bender. I don't deal with juveniles at all, but I will say she's phenomenal. I mean, while she's in that job, she's getting a master's, she's expanding programming access. She is very involved in the community. Unfortunately, she's not affiliated with the county. She works at,
Okay.
so I don't deal with her, but I have met with her because she does phenomenal work. And I was on a youth coalition for a while, and she was a member of that, and she does great things with the youth. Well, maybe that's why our numbers are down. But yeah, I would reach out to her if you have more questions about the juvenile diversion program, but she does a phenomenal job.
Thank you. I definitely will do that.
Thank you. Can you, would you tell the committee a little bit about how you used the electronic monitoring, you said, to good success? How do you, who oversees it, and who has the authority to pull somebody in if they're violating their bail conditions?
So Captain Blasek, unfortunately, she's in Jamaica right now because
Yeah.
I was calling her before her flight. She oversees the program, and we don't typically, let me take a step back by saying that in treatment court, we don't have a lot of people absconding. I know you've discussed a lot of failures to appear. I think because we're such a small community and like Keene is our city. I guess I shouldn't do air quotes. Keene is our city. And so the Keene PD know all of our population. Like I can run into anyone on the street and they'll say, have you seen so-and-so? So like I can tell you that for me, as far as absconding, I've had 2 names on my list for like 6 years, but I know by going on Facebook, one's in Vegas and the other one's in Alabama. And he actually just reached out to try to clear it up. So people don't really leave where we are. It's a small, sort of very tight-knit community. Captain Blasek does EM for the jail, so the probation does not provide electronic monitoring. So Captain Blasek has been doing it for several years, and she does have a standardized checklist of who's appropriate. And I know they've expanded it because the number of people on EM right now are much higher. Like there's several people that are out on EM. I thought I had that number with me. I can get you that number.
Do you use it strictly post-sentencing, or do you use it to monitor people who are pretrial?
So they have several that are pretrial.
Okay.
And, but that's not a decision that I'm a part of because I don't deal with the bail commissioners or bail at all.
Okay. Do you know who sets those? Who imposes that condition? Is it usually the court?
Yes.
Okay. And you spoke about the Medicaid. We've heard that counties have had a difficult time getting reimbursement unless someone is admitted to a hospital. Have you found a way around that to get services reimbursed?
So that's a jail issue.
Yeah.
And it's a phenomenally bad one for the jail because they spend a lot of money.
Yeah.
I know that the jail did just receive an MOUD grant to cover some expenses and some MAT expenses, so medication-assisted treatment. And so I know they received that, but as far as their medical bills, no. And I know someone else testified that once someone's in a hospital then that'll be covered. But yeah, I was working with Doug Yazway for years trying to figure a workaround. I mean, that'd be wonderful if medical expenses and while incarcerated were not cut off.
Yeah. it seems that there's two systems working against each other. The insurance companies are incentivizing the hospitals not to admit. And if they don't get admitted, then Medicaid won't pay the state or the county back for the expenses. So it's going to need a federal fix, unfortunately, I think. but
Definitely.
We'll certainly be advocating for that. Any other questions from the committee members? Representative Stone?
Thank you. Under your program, do you also have individuals that are being supervised by either probation or parole department of the state of New Hampshire?
So yes, so for treatment court, and this happens a little bit differently around the state. So when you plead into the treatment court program, also known as drug court, you are agreeing to 5 years probation. So we have a probation officer on our team, and he supervises them for 5 years. That's reduced to 3 years if you successfully complete the program. And in behavioral health court, it's a mix. If they're post-adjudication and they're sentenced to probation, then yes, but not everyone who's in behavioral health court programs is on probation.
Follow up. And I take it there's no reimbursement from the state to the county to offset those costs, is there?
For the treatment court, we don't pay for that supervision. It's just part of the program.
Thank you.
So, yeah.
Representative Wheeler?
Thank you. So people who don't have insurance, when they come to you, you can get them into the Medicaid or Medicare program, whatever would be most appropriate for them?
For all of our programs, it's required,
Okay.
especially for drug court, because we have treatment providers. Now our treatment providers are online and they bill Medicaid. So yes, it's required for all of our programs.
Follow.
Yep.
When did that begin?
That they had insurance. I've been doing this for 10 years.
And
Anybody else have any follow-up questions? We all set? Well, thank you very much for driving here today. I
Sure.
do know how far it is. And I will certainly reach out to Chris if I have any further questions. And while we're here, I would just like to take this opportunity to tell everybody that is thinking about these programs, if your county doesn't have them, or if they have some of them but not all of them, reach out to your delegation. We're all members of our county delegation. Reach out to your executive delegation, reach out to your commissioners, start the conversation and make it happen, because it can happen and it really does great things.
If I could add one more thing. Sorry.
Certainly.
We also have a restorative justice program.
Yes.
That's overseen by Patrick Heenahan, and he was originally in the victim advocate because I was on his hiring committee, and now they've created a separate program. So he goes into the schools, goes into the jails, and is creating programs around restorative justice, and he's working with some of the people in behavioral health court as well. So we're constantly trying to expand our programming, but would love a robust pretrial program for sure. I have these pamphlets about some of the programs if you guys would like those, and I have other pamphlets I can send you.
So the documentation that you were looking off of earlier, I don't know if you have that in a, if you could email us that and then we could print it off for people to be able to look at the numbers. If you have it, if you don't, the other thing I was going to ask if we could make a copy of it, but I don't want to, put you out or make you uncomfortable if you're not comfortable with that.
I'll send you my notes. I mean,
Sure.
all it is just sort of notes, kind of
Oh,
random.
That would actually be very, very helpful for us. Thank you very
And I'm
much.
sorry I missed Muffin Day.
I know. Oh, if you don't mind, Representative Perry Gathright.
Yes, what was the person's name, Patrick?
Patrick Heenahan,
How do you spell that?
Heneghan. I tried to get him up here.
Is that the restorative justice?
I would like to know more about
Yeah,
it.
so the restorative justice program, speaking just a little bit about my understanding, is first of all, the victim in the crime does not have to agree, to the program. It is between the victim, it is between the perpetrator, and we have seen, my understanding is we have seen success with it, but I don't want anybody to think that is something that the person that has been wronged has to do, right? One of the things we always talk about is, the victim never being blamed for the crimes that were committed against them. But it is a nice option that they have, and, we have seen positive results with it, so we're kicking butt down there. All right, anybody else? We're all set? Thank you again.
Thanks.
So we are going to, we have some members of the public that have reached out to the chairman and myself that is going to talk with us in just a few minutes. And we're just going to take a couple minutes break.
Heavenly for a call. At this time, I believe we have someone here from the community who wish to testify from Manchester, I believe. Please. Have a seat and turn on the mic. Thank you.
My name is Jesus Lopez. Can you hear me?
Yep.
So let me just tell you who I am. I was born and raised in the Bronx. My mother had me when she was 13. When I was born, my mother was 13 years old. I grew up in a broken family filled with drugs, violence, no structure, nothing. I came to New Hampshire in 1993. When I came to Manchester, New Hampshire in 1993 from New York City, I thought I went to another world, because in 93 there was no drugs, there was hardly no homeless problem. Manchester was a beautiful place, okay? And I did come to Manchester, New Hampshire for the wrong reasons, and I'm going to get to that. But the reason why I'm here today is because a lot of the things that we're doing, in my opinion, is not working. And I know some people will agree and some people won't agree. So to those who don't agree with me, what I'm about to say is what I'm going to say first. Have you ever smuggled drugs across state lines? Have you ever packaged drugs for sale? Have you ever lived in a poor community like that? Have you ever been to prison? Have you ever had to deal with any of that chaotic stuff? And if the answer is no, then with all due respects from the bottom of my heart, then I'm sorry. You don't know how to fix this problem. Okay? It would be the equivalent of asking me to go into suburbia world and try to fix a problem up there. I don't know. I don't know anything from there. I'm not from there. I'm from what they call the ghetto or the hoods or bad areas. Prison reform, bail reform is a joke. I'm gonna tell you that right now. And this is coming from an ex-drug dealer. I did 10 years in prison, in federal and state prison. Not proud of it. But bail reform doesn't work. It's a joke. You know, you have people, I know a lot of officers in Manchester that say to me, you know, I can't even finish my paperwork, and this guy or girl's already walking out the door. You know, and committing the same crime 2 hours later. I'm chasing him around the city again. So that's not working. Bail reform is not working at all. We need to go back to what it was. Here's the big one. Minimum mandatories. If you're against that, you don't want to fix the problem. Bottom line, straight up. And this is coming from a person that at one point, I would never speak this way. minimum mandatories, whoever thinks blowing people's heads off and putting them in jails and burying them under the jail is not the answer. Oh, you can't do that. Then again, sorry, with all respect, you don't know how to fix this problem. I'll tell you what brought me to New Hampshire. And what brought me to New Hampshire 30 years ago, and it's still bringing people here today. I came here in 1993 because, again, remember the lifestyle I told you I came from. Some guy came to me and told me, hey, that piece of crack that you're selling for $3, you get $30 for that in New Hampshire. I was up here that same week. Never went back. So what's happening is that you're getting a lot of drug dealers. 95, 96, 97% of your drug dealers are not from this state. They're from out of state. They come here because their kilo that costs $20,000 in their state is $100,000 here. And we're not doing nothing to them. They're getting caught and they're being released. There's no punishment for them. There's nothing. So, again, you know, we need minimum mandatories. You want to scare away a drug dealer? This is the next drug dealer you're looking at. You're going to scare them with minimum mandatories. If they know they're going to come to New Hampshire and get put under the jail for selling drugs, they're not going to come here. They're going to choose another state. Why do you think a lot of guys don't go to Maine? A lot of street guys don't go to Maine. Maine will bury you in the jail. So if you think that minimum mandatories don't work, you do not want to fix the problem, period. And I'm tired of burying close friends of mine, family members, because nobody wants to fix the problem. This is not going to fix the whole problem, but it's going to fix a lot of it. Your secret indictment program is a joke. It's a joke. People on social media are reading that XYZ dealer got arrested at 4 o'clock in the morning, but there's no, you got to let your presence be felt. Do like they do in New York. TNT buy and bust sting operations. You don't let somebody sell to you and then you come get them at 4 o'clock in the morning where the public and the community doesn't see this. They don't see this. Out of sight, out of mind. The police don't care. The state don't care. They're not doing anything about it. But if you do TNT, Technical Narcotics Task Force, buy and bust operations, broad daylight, where the agent goes down, makes the buy. As soon as he makes the buy, he's walking away, blue hat, red shirt, blue jeans, blah, 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 screeching tires, boom, boom, boom. All these guys jump out, law enforcement jump out. You're letting your presence be felt to the community. You're sending a message to the community, hey, we're here for you. And to the drug dealers, we're not playing around no more. The way you're doing everything now doesn't work. I'm sorry. I'm so sorry to tell you that. Another thing that I wanted to say was, I feel bad for the addicts because I come from a family of drug addicts. But we could write legislation in this state, and I guarantee you other states will follow suit. We could write legislation in this state, just like Robert Blakely wrote the RICO statute. We could write a statute in this state that applies to opiate dealers. And we give them, and those opiate dealers, we bury them in the jail. Oh, how do we sort out who's an opiate dealer and who was a poor addict that was getting somebody from somebody for somebody else so that very easy, very simple to do. In the booking process, when they are arrested for sales of, we write legislation, we make this law, okay, that applies to drug dealers, not drug addicts, drug dealers. How we decipher the two? Well, one, we can tell by just looking at them, number one, but that's not a good way to doing this. We need confirmation. So how we get confirmation? In the booking process, fingerprint, mugshot. You're not a dealer? No? You're an addict? Piss in this cup. At the time of arrest, in that cup, if you don't give me a positive for opiates, you're not an opiate. You're a dealer. You're not an addict. And I don't care if you give me a positive for cocaine or marijuana, because I know a lot of dealers that do cocaine and do marijuana. Opiates. And if you are a true opiate addict, then that releases you from the new law that we would write that would put you in jail for a decade at minimum. You want to make change? That's where you do. This is where we start. This is how we start this. Otherwise, I'll tell you what. Your kids, your grandkids are going to be here 20, 30 years from now talking about the same problem. You want to really do something, this is how you do it. This is coming from a guy who once lived that side of the tracks. There was a time in my life you couldn't pay me to come here and talk to you guys because I changed my life. I was once illiterate. I couldn't read. I couldn't write. Growing up in the Bronx, I didn't have education. I think my highest grade completed was 6th grade. You know, and so all the things that I was taught from when my grandma passed away, I didn't have no more. I was a man at 13 years old. I had to undo all those things because they were all wrong. And I realized that today. And I'm trying to help you guys to help everybody else in the community, addicts alike, because I come from a family of addicts. And the addicts, we need to start treating them like addicts. Give them an alternative to incarcerations. Give them empowerment so they can build themselves up from the inside out. You understand? And we got to have real, true care in this, too. It can't just be on the surface. Oh, we're going to sit here and just say we're going to do something. We got to really do it. And it's got to be full care. And I'm sorry, for the drug dealers that come to New Hampshire, send a loud, clear message. You come to the state to sell your crap, we're going to bury you in the jail. End of story. You'll see a decline. You'll see a decline. Whoever says, again, I'm sorry, with all due respects to everyone, please, whoever thinks this doesn't work, minimum mandatories, you don't know what you're talking about. You never lived on my side of the tracks. You don't know what scares us. Well, I should, not us, because I don't live that life no more, but you don't know what scares that group of people, drug dealers. And again, the only way to know that is you had to have once partaken in that whole life, chaotic lifestyle, which I did. So I, in all fairness, I think I'm the guy to give you the greatest ideas how to fix this or how to put the hammer on this problem. You know, I want to thank everybody for bringing me here, for letting me come here. I called and I was trying to get here. I was just trying to call everybody I could, and finally they gave me the okay to come here because I needed to address this to everybody. You know, there's a lot, because I know there's a lot of people. I hate to say this, but a lot of Democratic parties don't believe in minimum mandatories, and that's not true. You're confused. Sorry, you are confused on that point. Minimum mandatories will send a message to drug dealers. Let's start doing something about it, because it could be your child next to die from an overdose, from that very same drug dealer that came from Massachusetts or New York or New Jersey or Philly.
Could you tell us more about what you're seeing in your neighborhood? Whereabouts do you live?
I live in Manchester. I live 655 Chestnut Street, so it's kind of okay area, but I spend a lot of time in the inner city because I take out lead-based paint for the city of Manchester. I'm a contractor, and I take out lead-based paint, so I'm always in the city. And not only that, I've been involved in this. I mean, in 2016 and 17, for 2 years straight, I was helping people detox in a garage this size. I had bunk beds in there. And I'm seeing a lot of drug dealers coming from other areas. There's a lot of drug dealers that come from other states, you know, and they come here to do exactly that, because that's just it. You know, if they can spend $5,000 in their state, in the state they live in, and they're only going to make $10,000, they'll do it. But if they're going to spend $5,000 on drugs in their state and bring it to New Hampshire and make $50,000, they're running to this border. They're running here, and they're going right to Manchester. Manchester's the hub, okay? And then from Manchester, that's where they realize, oh my God, we're in North Conway, or over here, or over there, or in Dover, or over there, over here, and then they start to spread out. But your drugs ultimately come, and when they come up here, they hit Manchester, number one, and or the Portsmouth area, because 95 comes up that way. Okay, so these guys that are bringing this stuff up here, you want to deter people? Break their backs in the courtrooms. You gotta do minimum mandatories. You know, even on a first-time offender, I don't care. Write legislation, a decade minimum mandatory. You know why? Because when he's in jail, all his friends, man, they gave me 10 years up here. They gave me 10 years, these assholes. They gave me 10 years. Everybody, the word's gonna go around. You know, before you know it, people gonna be like, you can't go to New Hampshire to sell drugs. They got minimum mandatories up there.
Could you address the public perception as far as you're aware of the bail system now? If you get arrested, what's going to happen to you?
Yeah, I've seen it. I've seen it a lot. I watch the news a lot, which I shouldn't, and I'm involved in the community a lot, which I'm trying to change it. But I'm one person. It's like I'm fighting a monster with multiple heads. The minute I think I'm gaining speed or something, it's like 5 heads come on and bite me everywhere. So what I mean by that is like I see crimes going on, and the person that commits the crime is out within 2 hours, 3 hours. And later on that night or the very next day getting arrested for the very same thing. You know? And it takes 3 or 4 times before the prosecutor tells the judge, hey, why don't we do a preventative detention? Preventative detention? I've never even heard of that. That's a joke. It's give them bail or no bail. Period. You know, I just feel that you could do a lot better, especially with the you want to drive the drug dealers out. Get rid of your secret indictment program. Get rid of that, and do TNT, Technical Narcotics Task Force, buy and bust operations in broad daylight where everyone can see it. You're gonna send you're gonna send a message to the public. You're gonna I believe. It's only my perception of this. If the community starts to see this, it'll build a closer relationship with the police department. Because out of sight, out of mind, the cops don't care. They're not doing anything. The people that sell drugs, But if you're doing it in broad daylight, and the community seeing this, I think it restores a little bit of hope in them. That you guys are cleaning up the community and stuff like that. I live in these communities. That's what it would do to me if I saw that. So living in that community, and I asked a lot of people, if you saw them coming out, jumping out, grabbing everybody who sold the drugs, would that restore your faith a little bit? And I get a smile a lot. I think it would. Yeah, it would. I would love to see them do that. It always brings a smile from somebody. I've never once seen somebody, unless they're a drug dealer, which I don't ask them, they'll be like, no way, I don't want to see that. But everybody who is a citizen that lives around the Union Street area, who doesn't involve themselves in drugs, that I've asked these questions to, would you like to see it? That'd be nice, right? If they start doing that, oh my God. What are we waiting for? We're waiting for. You know, we're waiting for more and more people to pass away, for the problem to get bigger and bigger and bigger. It's gonna get it's gonna get bigger. You're gonna need the feds to help you again, like you did in 95 and 96. You had to call the feds to come help you to do Operation Street Sweeper. You know? Yeah, I really thank everybody for bringing me here, letting me say what I needed to say. Like I said, there was a time in my life I would never speak this way. I would never speak this way. There was a time in my life. But, you know, again, I was taught the wrong things growing up as a kid. So I had to undo all of that. And I did a little bit late, but I guess late is better than never. And today, thank God, you know, I don't even dream about that lifestyle. I have a small business. I do a lot of work. We keep kids safe from lead paint poisoning. And that's what I focus on, you know, and I try to keep, I don't even help people detox anymore because I lost hope. So now all my energy goes on trying to save the kids. There's a nice program in Manchester called My Turn, and I try to reach out to those kids there, crime deterrence and prevention. I got a guy who's a professional boxer. He's gonna start training the kids in there, get them burn off some steam or whatever. And just, you know, but back to minimum mandatories, TNT buy and bust operations, and bail reform. I think we need to look at that as a government body. You guys need to look at that. Democrat, Republican, Independent, doesn't matter. Get together. All of you guys get together as a team and turn this whole thing around. Not just for you guys, but for all of us. For everybody. You know, we're all one person away from addiction. Period. One person. And before it takes somebody that you care about, let's try, or maybe it already did. Maybe I'm speaking, but let's try to tighten up that knot and get the drug dealers and lock them up. And
Thank you. Any questions from the committee for this witness? Representative Stone?
Thank you. From your experience in seeing people on the streets using narcotics, the low-level, street-level dealer and addict, are they safer on the inside or are they safer incarcerated?
the low-level addicts, again, low-level addicts they don't need to be imprisoned. They need an alternative to incarceration, in my opinion. Because, here's what they say. They say that, and it's proven through science. So they say that people who do this heroin and all that stuff, people are broken, and I guess everybody's broken to a certain degree, and I guess that when they take that substance, it fills that void. It makes them feel happy, and everything's okay. And so that's what they get stuck on, that feeling. But before long, they have, and I'm preaching to the choir, you guys know this, before long, they have two problems now. Now you're chasing the happy feeling that you got the first time you did it. And now you got a physical dependency 3 days, 4 days later. So I think they need alternative to incarceration, not to be with a 10-year minimum mandatory. That wouldn't be fair to them because they are suffering. They're trapped in addiction, and they need alternative to incarceration. They need mental health services and stuff like that because that's a lot of that comes from mental health too, being broken inside. I'm broken inside, I know. And mental health, they need alternative to incarceration. The ones that need the minimum mandatories are the ones who pee in that cup in their booking process and they don't give you a positive for any opiates. Because those are the true ones. The ones that don't give you a positive piss test for opiates, those are the true dealers. Those are the ones that are taking the money, buying houses, Mercedes-Benz, this, that. Those are the real, that's the real enemy right there. That's the real enemy. And those are the real, I don't want to use that word, killers, I don't know. But those are the ones that are really, people are dying left and right. It's their problem. It's their fault. I could get bigger than that, bigger than their fault. I could go to a government level, attack the cartels, right? But we're not government, right? Over there in D.C., we're here in New Hampshire. But the ones who are not giving you a positive urine test at the time of arrest for opiates, then you will trigger the new law or the new statute that we write, that we will give minimum mandatories to anybody selling fentanyl. Anything that has to do with opiates. I don't care. Bury them in the jail. And you'll see within a few years, you'll see a decline. Guaranteed.
What is the most common drug, if you're aware of, that's currently going around Manchester?
Fentanyl.
We've heard that there's some kind of other drug that's causing people to break out in sores. It's
Well, it's fentanyl, and then they have it's fentanyl, and then the methamphetamine. So I think what's breaking and making them break out and everything is that methamphetamine, because when they cook it over there in Mexico, I watch documentaries on this stuff all the time, and I'm not a pro, but what I know. They cook it over there in these 55-gallon drums in Mexico, and you should see them. They wear these Tyvek, they got documentaries on this stuff. They wear these Tyvek suits and full face masks, and some of them even wear provided oxygen, and they're mixing it in these big, and they're mixing all these chemicals. So these chemicals, they're putting it into their body. So I think that's what's causing that. But it's not like crocodile or any of that stuff no, it's not that. That's not on the streets. What's out there is mostly fentanyl, because they did away. What happened was, so heroin way back in the 80s, you can take 1 kilo of heroin and cut it with 10 kilos of heroin. It started to decline over the years, decline, until it got to a point where you couldn't even cut it no more, the heroin. They can't cut it no more because they'll make it weak. So some I don't know who got the brilliant idea to for Purdue Pharma, I blame too, to come up with the fentanyl. Fentanyl was designed originally for a patch for cancer patients. Some smart guy took it and put it in a white powder. And so 50 times stronger, 100 times stronger than heroin. Yeah, nobody don't want the heroin no more. Now they want the fentanyl. And it's cheaper than heroin. And but I'm hearing that they're also starting to lace marijuana with fentanyl out there. That's a problem. That's a big problem because they're gonna take guys who never even did opiates. You're gonna give okay, they shouldn't be smoking marijuana, but they do, and they're gonna have a opiate problem before they know it, and not even realize that they have a problem. But that is the main drug is the meth and the fentanyl. That's the main things.
Representative Reed, did you have a question?
Yes, thank you. If I can, Mr. Chairman, I have like a 3-point question. We're working on bail reform and it's very complex. But my question is, one of the bills that we're working on is regarding, testing drugs. In your experience, do addicts take the time to test their
No,
drugs for fentanyl?
never.
Thank you. How much, we're also considering legalizing minuscule amounts of narcotic to transport to a center to test. And they're talking about a 20 milligram. So if an addict purchases their drugs, brings it to a center to test it for fentanyl, you're not seeing that in real life.
It's not gonna happen.
And thank you. And my last question is, do you feel that if we close the borders, we'll decrease the amount of drugs?
Absolutely.
Thank you.
The second question, the last question is absolutely 1,000%. The other two questions, the first two questions goes to this. I'm deeply sorry to inform you this, but I'm sorry you're wasting your time doing that. You really are. You're going to be wasting everybody's time and breath and energies talking about trying to get them to go. They're not going to do that. And not only that, here's the other problem. I believe if you do that, you're going to enable them. You're going to make the problem worse by doing that. Because at that point, you're telling them, okay, go ahead, go get high, just don't OD. Go steal, just don't OD. You're going to make the problem worse if you start to cater to the drug dealer, as far as, if we're going to cater to them, we're going to cater to them to get them off the drugs and give them an alternative to incarceration, or you go to jail. End of story. Do it on your own, or we help you do it. But if you start to cater to them, trust me, listen to what I'm telling you, please. You have to believe me when I'm telling you this. I beg you. I'll get on my knees if you want me to. I beg you. I come from a low-income area my whole life. I've been involved. I went away in 2001. I came out 2011, and I've changed my life. But before that, I was deeply embedded in the street life. I was a pro-drug dealer. I had a federal investigation here one time, and I shake the feds. I am smart. I know how to do this. If I was, I would never do that. But let's just say, if I went back to drug dealing, I would never get arrested. And I'm saying this because I want you to understand the magnitude of how that I know what I'm saying. If you start to entertain the thought of letting them indulge in drugs, you're going to make the problem worse. Facts. That is a fact. You will.
Thank you. Representative Harriet Gathright? Oh, Representative Wheeler, I'm sorry.
Thank you, Mr. Chairman. Thank you, Mr. Lopez, for your enthusiastic testimony. I know the life that you're talking about more than I think you understand, and I guess my question would be, when you're talking about trying to instill this fear in people who are selling drugs, is that worth the mandatory minimum, sweeping up the people who are not necessarily the cartel drug dealers? I mean, when we're talking about, and let me just finish my question here, when we're talking about the cartels, Purdue Pharma, the entity that fentanyl is coming from, I mean, these are large entities with a lot of money. And are picking up their street level dealers and putting them in jail for 10 years? Is that necessarily going to stop that industry? And then is that worth picking up the people who aren't a part of that industry, who have just gotten in such a bad way that they're now on the street dealing drugs and now are in prison for 10 years? Is that culture of fear well, number one, is that going to actually stop this problem of this, what is evil coming from this very well-funded force being put out on our streets? I don't think so, but I'd like to hear what you think about that. And then B, is it worth the culture of fear and potentially picking up people who aren't a part of that and have just found themselves in a bad way like yourself, who, given the right opportunities in prison or out of it, may find themselves in a different and more better place?
Absolutely to work. The first answer to your question is yes, we can't go after the cartels. We can't do nothing on a federal level, DC level. But I'm not worried about that. I'm not worried about them. I'm worried about this state. And as a state, yes, it does work. Because there's 50 more, 49 more. If you take and you lock it up in this state, you sew up this state, you will deter drug dealers from coming to this state to sell drugs, the way they don't like going to Maine. So if you're familiar with that, which I think you are, probably, I think you are. If you're familiar with that and you have family that, from that life, then you would know a lot of people don't go to Maine for that reason. They don't go to Maine. You got to be crazy to go to Maine. And minimum mandatories do work. It was a certain group in local government or federal government that never lived that lifestyle. Oh my God, you can't put him in jail that long. Oh my God, poor him. No. Yes, you can put him in jail that long. They're violating crimes. They're killing people with the crap they're selling. You goddamn right, put him in jail. Minimum mandatories, 10 years. That will work. And as far as the addicts, like I said, the addicts don't deserve the 10 years. The addicts deserve help. The ones who deserve the 10 years are the ones that are out there trying to be the baller. The baller. Selling kilos and this and buying a kilo and then doing that. Buying houses in the Dominican Republic, buying houses in Puerto Rico, or buying a Mercedes-Benz, buying $3,000 gold chains. Those are the ones that I'm talking about that need to be put underneath the jail. And I'm glad you said that, because yeah, I'm not concerned about it on a federal level. I'm not concerned about the cartels. DC got to worry about them. Washington, you know who Lindsey Graham and his crew. They're worried about them. They got a bill right now. They're trying to designate them as foreign terrorist groups. And if they do, they're going to go into Mexico and they're going to kick ass. So we can't do that here. I'm talking about what we could do here on a state level. See what I'm saying? So that's where I'm going with that.
Representative Rhodes.
Thank you, Mr. Chairman. Thank you for taking my question, Mr. Lopez. You had said you went to prison for 10 years,
Yes.
right? That was in New Hampshire?
Well, part New Hampshire, and then I went to federal prison. I had
Okay.
2 sentences.
Okay. And if I may ask, you said that you no longer live that lifestyle.
No, never.
Thank you for that.
Don't even think about it.
And
I couldn't even stomach it.
well, you're to be commended for your alteration.
Thank you.
And my question specifically is, what happened? Like, where was the switch? What happened to make you turn the switch?
Was when I was in Concord State Prison, and I took a pre-GD test, and they couldn't even score me. They couldn't even give me it was a 5-part test, and you gotta score 2,250 points, 2,250 to pass, and the top score is 3,000. I did so bad. There was no score for me, nothing. They couldn't even score me. It was an utter failure. So when I saw that, like I felt one day that happened, I felt like every bone in my body broke. And I went into like this depression. I still remember I was in H building in Concord State Prison. I was on C tier, and for like a week, I was so depressed. And there was a guy up there who worked at the education. He was a civilian. His name was Ed. He had glasses. I forget his last name. And he saw me one day, and he had like tears coming out his eyes in the yard. He had like tears coming out his eyes. He tells me, you know, you have so much burning desire in you. You could be such a good person, and I want to help you. Why don't you come to the school and let me help you? And I was just so defeated by my GED score, and I was just like, so I can't do it. Can't do it. Happened a long time ago, so nobody could get in trouble no more. But he told me, listen, if you come to the school, I'll bring you food from the outside every Friday, but you can't miss one day throughout the week. If you miss one day, you don't get the McDonald's or whatever it is you want from the outside. And he persuaded me to do it. And then he started to show me how to read. He showed me a dictionary, how to pronounce words. And I had a Monday, Tuesday, Wednesday, Thursday, Friday word. And so if bookshelf was my Friday word, then bookshelf in my head all day, bookshelf. So learn how to spell it, use it, spell it in my head. I want to put my book on my bookshelf. And just learning words like that. And then came like 3.5 years. He tells me, I think you're ready for a GED. So it wasn't like I had a learning disability or anything like that. Just I didn't care. I was raised the wrong way. I was raised into selling drugs and doing bad things I wasn't supposed to be doing. And when he said, you ready for the GED test, I was bubble guts. Are you sure? They said yes. I took the GED test. When the score came back, get ready for my score, 2750. I almost aced it. Jane Copeland was the prison warden at the time. That was before the escape. That was before Bruce Cattell took over. Jane Copeland had a small little party for me up there at the prison. Bought me cake, ice cream, sodas, and invited a few of the guys from the education and came over, maybe like 20 people, and had a little party for me. Congratulations party. And that's how and when I got out, you know, I changed my life. So that's it, no more. Like, it was a spiritual awakening almost, so to speak. Like, you know, something took over. And I got out, and then I started trying to help the community. Helping people detox, this, that. I'm real good friends with Annette Escalante. She's like the vice president of, vice president of the Farnham Center. And at one time, the Farnham Center, people would wait 3 weeks before they get a bed space, and people were dying left and right. And so I felt I had to do something about it. And that's when I had the detox place and stuff like that in my own garage and stuff like that. And there was another, I don't want to say his name, but he was one of your colleagues, right? He's in government. He told me, your heart's in the right place. But I'm scared, I'm worried for your safety. Why? What do you mean? They're not going to do anything to me. They love me. No. If somebody dies there, you could be brought up on charges. You're not licensed to do that. You're not a physician. You're not. And so I stopped doing it. I got scared that somebody would have passed away while I was trying to help him. You know? He said they could be coming off of alcohol and opiates and or benzos and or they could sneak something in your house, do it in your house, and then die in your garage. Then what? So a lot of light bulbs went on in my head, and I didn't want to stop helping them, but I had to. Sorry, I went down the wrong.
That's all right, thank you. Unfortunately, in our society, often no good deed goes unpunished. Any other further questions from the committee members? Well, you are and it's it's a tragedy to say this, you are the only citizen that reached out to us to want to speak on this, and I'm glad that you actually came. We heard hundreds of hours of testimony from experts and someone who actually lives in the community and sees it day to day. Other reason we're here in the first place, we're not here considering these bills because someone from within the criminal justice system said we need to. We're here because the public outcry has said we've had enough, something
Right.
needs to change. And the fact that you came forward is to be commended,
Right.
and I
Thank
thank
you.
you very much for
And
coming forward
his,
today.
if I could just add just one more thing.
Sure.
So, like, I know that there's people that never lived that lifestyle, you know, went to good Ivy League schools and this and that, and the ones that I say can't change the problem. And I hate to you put it like that, but it's logic. You can't argue logic. It's true. I know their heart means very well, and they put their best foot forward into some of these ideas that they put, but they're not the pros when it comes to the ideas. The pros are people like myself, maybe this guy over here, people who live in lower in communities. He looks like he comes from a big city. You wasn't born in New Hampshire, was you?
Oh, I was born in Keene, New Hampshire.
Oh, look
The
at that.
sticks.
Fooled me.
I've lived in the sticks my whole life.
But you know, but what I'm saying is, a lot of people don't come and speak because a lot of people don't have hope no more. They lost hope. They think that, oh, you're wasting your time. I try to get people to come with me today, and they give me excuses. I gotta work. I gotta this. Oh, you're wasting your time. You're wasting your time. They don't care. They don't care because this is what it has become in low-income areas. This is what they believe. Nobody cares. There's no hope in a lot of these areas no more, and especially Union Street. You know, you drive down Union Street. Listen, you don't have to go home and watch The Walking Dead. Just go sit on Union Street in Manchester. You're gonna see it. You're gonna see it. You're gonna see it. And you know what? In Manchester, right on Union Street, there's a basketball court. I would love to see a little sub-police station go up there. A little sub-police station go up there. They got one on the west side where it's not needed, where nothing happens. For who? They got one on the west side on Kelly Street, where nothing happens. The Heights. Nothing happens up there. But where everything is happening, they have nothing. This is why the people from that community give up and they say, you know what, they don't care. Because look, they got a substation over there where nothing happens, but over here, where we live, where all the action is, they don't got nothing. Another thing I want to add real quick. You guys might want to write this down. Abby Coet, Manchester PD. Abby Coet. Abby Coet, Manchester PD. She is phenomenal. One day, on Bridge Street, and this is why I say this, there was fire crew was there and ambulance was there, and OD. That's what comes to my head right away. And I like to keep the statistic. I like to wait. What happened? OD. Anyway, so I went to Abby Coet and I went up to her and I said, "Hey, can I get a minute with you?" Sure. I said, "What happened here? Is this like an OD or something?" She took the time, instead of telling me we're doing another, go over there, like most police do, go over there. She took the time and she explained it to me. She couldn't explain it all in one breath and tell me, hold on, wait a minute. If you want to know more, just go over there. I'll get back to you. And I did that to see if she would have got back to me. Because another thing that's important is police and the community. They got to start to get along again. Right now, they're not getting along. So I did that to see. And sure enough, before she got back in that cruiser, she walked back over. And she asked me if I had any more questions that she could answer me. And I told her, no, I don't. You know, I just wanted to see if you would really come back and see if you were going to answer any questions that I may have had. And I'm going to drop your names to some people up there because you are true policing and community. And if they ever did a program where they train police officers, public relations with the community, you should head that. Abby Coet should be the head of that because she's.
Thank you. Linda, excuse me, Representative Catherine, you have a question?
Thank you, Mr. Chair. Mr. Lopez, have you had a discussion with the chief of police for Manchester or with your mayor or with your council folks? I'm just curious.
I try to reach out to the Madam Mayor so many times, Joyce Craig. She never responds back. Put it this way, I'm not voting for her.
Okay.
Follow
up?
I'm sorry, she doesn't though. Joyce Craig, that's how she has me.
All right.
so many things I reached out to her about, good things, she never reaches out to me.
Yes. What about your city council?
I don't know who he is. The only ones that I do know is they're not even on Pat Long. I know a few guys, but they can't help me. I know Pat Long, he's an alderman. I know Joe Kelly, he doesn't care. I know Lou D'Alessandro, he doesn't care. Dan Phelps, he was not here no more, I don't think. And that's all that I know for government body.
And who would follow up?
And I know you guys now. I like my friend over there. I'm gonna reach out to him more.
Okay, and your chief of police?
No, I have not reached out to him. See, here's the thing. I've tried. I've made attempts in the past. But what happens is they take a message, they don't respond to you. They don't respond to you.
Thank you.
I would love to talk to the chief of police and give him some ideas. You know, again, I want to say this. I'm not the sharpest knife in the drawer. I'm not. I'm not saying that, and I'm not here to say that. I'm not here to say, hey, what I say is what I say was what works, and that's it. And that's not what I'm saying. I'm here to help. I'm here to give you, everybody, my experience, what I know would work in these communities, these low-income communities, because this is where I grew up my entire life. This is where I grew up my entire life. If you take me, if she took me to her, let's just, for example, let's just pretend, okay? She has a beautiful home, beautiful in suburbia life. If she took me up there, I'd be dumbfounded. I wouldn't know what to do because I've never lived that. I don't know if I'm making sense, but I've never lived that life. I would be lost. So it's those very same people. You can't fix my world. You can't. I'm sorry. I'm not being rude, and I'm not being cocky, or I'm not being anything. We're speaking logics. These are facts. You can't solve these problems. You need people from this community, from this side of the tracks. You guys are the people who sit at the throne that can make the changes with the input from these people here. Make sense? You can make the changes. You have the power to make the changes, but you need the input from the people from this side of the tracks. And again, I'm going to say it one more time. Drug dealers, if you are selling drugs in this state, and you are a cold-hearted drug dealer, not an addict, and I don't care if you do cocaine and smoke weed. You're not an addict, in my opinion. You're not an addict. You gotta be an opiate addict. Write legislation, just like Robert Blakely wrote the RICO law. You apply this, I'll help you. I'll write it for you in my own language. You can put it in legislative languages. I'll do it for you. Put it, and it applies to drug dealers and drug dealers only. It's the same thing Robert Blakely did to target the mafia. Why we can't do the same statute to target drug dealers? Why? What's so hard about that? It's not hard. It's easy. Let's get together. Let's get in a room. Let's write legislation. Put it on the floor. Let's talk to. Let's get Sununu to pass it, sign it into law. We have our own drug trafficking, so to speak, like RICO Act in New Hampshire. But that applies to drug dealers. But it has the same principles. Shares the same principles of a RICO statute. But it applies to fentanyl, heroin, and opiate dealers, true dealers, not addicts. If you went and bought heroin for somebody and you took it to somebody and you got somebody to deal for yourself and you did it, you're not a dealer at that point. I'm sorry, you're not. You could qualify for alternative to incarceration. Otherwise, let's not do nothing. And 20 years from now, 15 years from now, we'll be having the same discussion again. And I'll just be older.
Thank you. And I think that's a perfect note to end on. And that will be, and I also think it was very timely that this is the last of the testimony we'll be taking. After this, we'll be sitting down to write whatever we're going to do. So we appreciate
Thank you
very
so much.
and
Thank you for having
coming.
me. I thank everybody. Thank you.
And with that, we are closed for today.
Thank you.